Dr. Sanjay, I think we can start.
Okay. Okay.
Good afternoon, everyone. Welcome to the 100th episode of RSSDI Diabetes Bytes. May I invite Dr. Sanjay Agrawal to take over as the National Secretary of RSSDI to invite our dignitaries today and to handle the reins of the show.
Thank you very much, Dr. Purvi. First of all, let me begin the program by complimenting our dynamic Dr. Purvi Chawla. Running 100 shows is no joke. And I think she needs a round of applause from everybody for making this possible. I think she's been so dedicated to this platform, and we've had some excellent interviews from all the knowledgeable people across the country and some of our guest speakers who have contributed about diabetes as it stands today in terms of therapeutics, diagnostics, policy making, what the body does. So I think compliments to you, Purvi, for making this show such a wonderful show. And as I see exponentially, more and more viewership is increasing on the platform, which talks volumes about the quality of the program that you've been, airing every week after week. And it's no small thing to do. So I really compliment you for this wonderful thing. Yeah. All right. You want to say one thing? Just what was the okay? Let me start you on the hot seat. What was the highlight for you for diabetes bites before I put the other three in the hot seat?
I think today has been the highlight, or is the highlight for me, because it was a personal challenge as well. We had it in mind that we should go non-stop, at least for 100 weeks, and see if we can go ahead with the vigor, the strategy, and bring more and more innovative as well as interesting programs for our viewers. So it's been the single most highlight, besides the fact that it's been such a huge learning curve and the interaction with all the global experts sitting right here in my chair. I think it's been absolutely stimulating, riveting, and very, very interesting journey.
Great
If
job.
you allow me, I'm just going to, share with our audience what we have, how this came about in the next few minutes, and all the people behind this absolute, journey of 100 years. I mean, 100 weeks.
Please go ahead. It's all yours.
Okay. So first of all, my pranams to all the RSSDI stalwarts here, Dr. Vasant Kumar sir, you, Dr. Sanjay Agrawal sir, Dr. Banshi Saboo sir, and Dr. Brij Makkar sir. Welcome to your own show. So 2 years ago, an idea was planted very firmly like a seed, and today it has grown into a beautiful tree with branches, and it's further bourgeoning. RSSDI, one of the largest association of physicians dedicated to the care of people with diabetes, had almost no social media presence 2 years ago. But with the visionary initiative of the then leader, Dr. Banshi Saboo sir, and with Dr. Sanjay Agrawal sir, backed by the entire executive committee of RSSDI, this project was undertaken with simple greetings, the Ramadan advisory, and a welcome video from all the RSSDI EC members. The various handles of social media dedicated officially and solely to RSSDI took off. Next came the series Diabetes Bytes, an FB Live program wherein all experts from RSSDI itself as well as other cross organizations came together live on every single Thursday at a particular time in the evening and discussed various pertinent aspects related to diabetes for and engaging and enhanced learning of the audience. We faced several technical glitches but did not bow down and marched ahead. The very first episode had the first and only woman president of RSSDI, Dr. Sarita Bajaj ma'am, and the only woman EC member, Dr. Shalini Jaggi. On that auspicious note, 2 years ago, Dr. Banshi and Dr. Sanjay kick-started this wonderful series with one primary aim to spread patient and public awareness of diabetes, early screening, preventive, and managing diabetes. And it was intended to support people living with diabetes through the tough COVID times. And the second aim was also to make known to the public the initiatives of RSSDI and the social welfare activities of RSSDI. Today, Diabetes Bytes and RSSDI are both a household name. Huge credit goes to the entire RSSDI team of social media. Dr. Amit Gupta, who is also in the current team, Dr. Shalini Jaggi, Dr. Pratap Jetwani, and Dr. Sanjay Reddy, who are current EC members and have provided stoic support to this team. Dr. Neeta Deshpande, who's also associated with the Obesity Task Force and other initiatives of RSSDI, and the current team with Dr. Faraz Farishta, Dr. Rakesh Parekh, Dr. Supratik Bhattacharya, Dr. Krishna Prasanti, Dr. Amit, and myself. We at RSSDI social media also wholeheartedly and consistently supported the world record making campaign of RSSDI, the Defeat Diabetes campaign, that created history in the world as a mass public health campaign. With your presence today, and as we await Dr. Jitendra Singh, sir, also to join us, the Honourable Minister, it's a great encouragement for us to work further and come up with more interesting as well as innovative ways of reaching out to the people, carrying our message of early screening and preventing diabetes. For women's health in particular, there are two areas that need particular focus: preconception as well as managing the perimenopausal period of a woman. So, with that, without much ado, I hand it back over to Dr. Sanjay Agrawal, sir, and thanking each one of you for your guidance, for your encouragement, and also the acknowledgement of various milestones achieved through this uh, in taking this further. So, thank you once again, and we hand it back to Dr. Agrawal.
Thank you, Purvi. I think we look forward to more episodes in future. Now, let me just introduce our three guests till Dr. Jitendra Singh joins us. But I have on the hot seat Dr. Vasant Kumar. He's the current president of the RSSDI. We have Dr. Banshi Saboo, who's the immediate past president of the RSSDI, and we have Dr. Brij Makkar, who's the president elect of the RSSDI. And I'm going to take great, I'm going to make the most of this opportunity to put them on the hot seat because last couple of months I have been on their hot seat. So it's like payback time, and they have to answer all my questions. So let me start with Dr. Vasant Kumar. Today's social media has come about to play a very important role in our life, not only in terms of information, but also in terms of how we can connect with people. Where do you see RSSDI going ahead? When it comes to engaging people on social media.
Thank you, Sanjay. Before I answer your question, unfortunately, we are missing the minister. He might join us. We called Dr. Jitendra Singhji because he's also the patron and he has been a part of RSSDI, but I'm sure he had many more important things to do. After saying that, Dr. Sanjay posed a very important question about the role of social media. In fact, social media plays a huge role in every aspect of life. And then it made things easy for RSSDI to spread awareness. When I say awareness, awareness about so many things, Sanjay, we know, not just at the uh, disease control or disease management. It's about prevention. It's about telling every aspect of the health. And then we, fortunately, because of this, as Purvi said, we devised this thanks to you and Dr. Bansi. And for last 2 years, we have relentlessly went on with these programs program after program, and which has exposed it to the very larger population. And one great thing about it is it's not just in English. Many times we also spoke in the national language, Hindi. And I'm also looking forward to do these kind of programs in regional languages. So to very briefly say that it plays a very huge role in spreading the awareness, especially about a condition like diabetes, which is widely prevalent all over India, whether you're talking about rural, urban, wherever it is. And we also know social media is very, very much present in every part of the society now. It's not just the young, it's also the old. It's not just the rural, urban, everybody is seeing. So I feel, Sanjay, we are already into it. And I'm sure with your support and everybody's support, we will do it much more often, and we'll reach out to all the 130 crore of people on this aspect. Thank you.
Thank you very much, Dr. Vasan. Brij, I'm going to come to you. See, there is always this information that people need authentication. So, obviously, from the RSSDI, we have been ensuring that there is good communication that goes out to our membership. But yet, the information network is so huge. How does somebody identify good information from bad information, particularly when it comes to health matters, which can make criticality in terms of the decision making?
Very important question, Sanjay. And first of all, thanks for having me on this Diabetes Bytes show. Uh, First thing, I think the source of information we should always check. If it is coming from an authentic source like di- one we have, the major source of information comes from American Diabetes Association. There is International Diabetes Federation. There is, we have our own research society for study of diabetes in India website. So all diabetes societies, which are kind of non-for-profit, non-commercial organizations, usually provide more authentic information and more relevant and realistic information. Second thing is, whenever you get the authentic information, you will hardly be seeing any false promises relating to, that you are offering a cure or you are offering a magic pill, or if you are going to offer a wonder to the patient, and everything will be taken care of in no time. And you had certain videos coming from you know self-styled diabetes specialists providing cure on national channels. And there are so many channels which offer you medications that can take care of not only type 2, type 1 diabetes and so on. So all those things will be missing from the authentic information. Authentic information will usually tell you about the disease, the process behind the disease, what you can expect from treatment, and what all is the responsibility of patient in terms of helping himself or herself in managing the disease. The the false information will always have some inbuilt promise for some magic, some miracle, some cure, which is missing from the authentic information. And it is very important that people don't carried away with the false promises and the useless information that circulates on the WhatsApp university and internet. And because this can be actually very bad for patients diabetes management, and some of the times if they end up leaving things like insulin, they can get into crisis, they might need hospitalization, and that situation can be life threatening also.
Dr. Bansi, I want to come back to you. I think, thanks to the pandemic, we have realized the power of the virtual world. And it has become now the way of life that people's behavioral patterns are being changed through the virtual world. So you've got number of websites, virtual apps, which talk about behavioral modifications. I'll just take you for an example that we have a number of apps which alter the lifestyle modification, or by which you can have an impact on the weight, you can have impact on nutrition. What is your sort of message to everybody, that how does somebody engage, where should they stop, where should they engage on virtual world, and where should they stop and say that this is where I stop and I need to go for a physical, interaction with a particular expert, be it a doctor, nutritionist, lifestyle coach, or whatever it may be. So, what
First
is
of
your thought behind this?
First of all, thanks Sanjay and Purvi for having me here on this RSSDI 100th episode as in past president of RSSDI. Congratulating the RSSDI complete team of social media and Diabetes Bytes. We started this before 2 years and it is continued. And as Dr. Vasant Kumar was telling, under his leadership, all state chapters are now highly excited, and we are now going to have a lot of regional diabetes bites in a regional language also. So primary purpose is to increase the awareness in the society so everyone can get the help of it. I mean, they can get benefit of it. Now, the point which you are talking about, the how different apps can change the behavioral pattern of our diabetes patients or the caregivers. So I will divide into one third, one third, one third. One third of them are not at all interested in any type of apps anywhere, and that may be slightly older persons, maybe elderly, or they are not very much versed with these newer apps. So even if you try to give them any sort of a digital connect to them, they are not interested. Even you have a connected glucose meter, you have distantly you can monitor them, you have different types of app, and their behavior is not going to change by giving them any sort of apps. Now, two-third of them, even they understand. Again, out of them, one-third of them, it means half of that population is not interested. So a small number of persons who are really interested, who are digitally connected, and that number is significantly increased in last 2 years because of COVID pandemic. They were not in position to come to our clinic, and we could get connected with them through the different apps. It is maybe that distantly we were monitoring them, and we were trying to change their behavior also. And some of these apps are really good because they help our patients and their caregivers for educating them, not only for diet, for exercise, but for their education of different aspects of the diabetes too. But again, the one third of them, which I told you, even they are well versed with the scientific, I mean, these all digitally different apps which are available to them, but they are not very comfortable and they would like to meet face to face. They would like to occasionally use these apps or occasionally use these digitally connected the doctor's consultation, which they will use only during the COVID time. Now they are again back to our clinic. So you have these two varieties of patient, and as I told you, one third of them are not at all interested. But yes, these apps are really good. But I think now RSSDI can come out with some sort of a white paper where that which are good and which are bad, how they can be beneficial, who are not going to get the benefit out of these applications. Also, some of them are costly, some of them are free, and they all can be really beneficial for those who can use it, those who are feeling comfortable with these digitally connected apps, and they can really change the behavior pattern of diabetes patients too.
Brij, let me come to you for a very important question, more from policy point of view. I mean, all of us have been in the decision-making body for a long time, and one of the key areas that we find a paucity of information is data regarding the Indian population. And often we miss this because we haven't had a central agency which does the collection of data. Do you think going forward, since you're going to take over as the president elect, and currently Dr. Vasant is, and I'm going to ask this question to both of you because you're going to be the decision making going future. What are your thoughts about, having a mechanism by which we can start collecting data on the Indian population so that in future we will be able to come out policies which are pertaining to our own population and give them strong directives, what works for us?
So I think this is one of the most important issues and one of the most important deficiencies in our system of managing diabetes that we face in day-to-day practice. And so I think it is not just deficiency in diabetes management; it is one of the important deficiencies we see in our healthcare management system, that we do not have a uniform, data recording system. And also, it is not just that we don't have a uniform, most of the places that data is missing. The records of patients are either the paper records, they are also poorly, recorded documents. and they are stored for, I think, a limited period of 3 or 4 years. Beyond that, they are not stored. So if you want to retrieve some data, or if you are in the chronic disease management area where the patients are under treatment for decades together, you need to have their data available, and the only way that can be available and analyzable is the digital format. So we need to have a uniform kind of, or if not uniform, multiple systems of electronic medical recording, which are easy to operate, which are easily available, but are compatible with each other in terms of pooling data. And if we have data, actually we can learn about the disease process in the country. And the more we have information from the data that is compiled, the better we are in understanding the disease, and better we are in managing the disease. And also we are better off in allocating resources for different areas of management which are important, and maybe have lesser resources in place where the areas are not really important in Indian setting. So I think use of digital technology is the way forward for managing any disease, not just diabetes, in any country. It's not just India. And I think we need to focus on that. That's going to be one of the focus areas. In fact, I must, compliment Dr. Bansi and Dr. Basant Kumar. The process has already been started for last 2 years. And we have, the Defeat Diabetes program that we did, we already have data for more than 30,000 patients, though we had, limited information collected. That kind of information can give us huge insight into the disease process. And this is the way forward. And the process has already been started. And I am, really happy to take it further and take it, as far as possible. So digital support for disease management is going to be the way forward.
So, Dr. Vasant, I want to come back to you. We know that the government has the largest resource, and it has all the machinery behind it which can support this. As a president of RSSDI, how can we work with the government of India to see that we can give them help, extend help from our body, and to make this entire thing possible? So, what are the possible ways that we can help the government to effect better healthcare for our patients with diabetes?
Dr. Sanjay, you already know that we are trying to see the methods. And the one important point that you mentioned is the roles, the different roles of different all the Indian people at large. It's not just disease control, it's also about prevention. Non-communicable diseases have rapidly increased in every part of the country. We are talking about it every time, everywhere. But it is just not possible for the government. Government has been doing a lot of things now. They have a rural health mission, they have urban health mission, they have commission on the non-communicable disease prevention and so many things. But it's not possible for the government to do alone without the help of professional organizations, NGOs, and other civil organizations, where certain small countries like Singapore are following it. So we are trying to impress on the government of India as well as the states, RSSDI being the largest organization in even in Asia. So we want to really work out. We are eagerly looking forward to meet and it was one of the reasons that we wanted Minister Dr. Jitendra Singh to be here. But anyway, we will try to contact him and also express our willingness and our concern about the health of the nation. So health of the nation is the concern of everybody, not just the government. It's the concern of every responsible citizen in this country. Obviously, the professional organizations, RSSDI, is very much intensely involved in disease prevention. The research that we want to do, as already Dr. Sanjay has already said, that the data collection, we want to make it country-centered. And in the next couple of years, we want to really show the strength of our organization. And we can actually see that the government becomes stronger with our association so that we reach out to more people. Our goals of the government will be fulfilled if we all work together.
Absolutely.
And I'm sure we will try to take this forward, Sanjay, all of us.
Absolutely.
Thank you.
No question about it. I want to come back to Dr. Bansi. We always talk about diabetes in isolation, but in practice, we know that it never happens. We have patients who have multiple, other medical issues. And today, as Dr. Vasant was referring to, the challenge of non-communicable diseases. Uh, we know that as much as diabetes has been exponentially increasing in its incidence in the country, so are all the other non-communicable diseases. So I want to come back to you and say that how can we reduce the burden of non-communicable diseases in our country, where we are addressing the dyslipidemia, the lipid problems, the hypertension problems, the obesity, diabetes. What is your thoughts, because you've been part of this organization as well as you've been the past president, you did a lot of efforts to bring this in focus. So I want to ask you this question, that how can we reduce the NCD burden in India?
So you very rightly said that diabetes does not come alone. It comes with a lot of comorbidities. Diabetes is a condition. It's a metabolic condition which is because of obesity. It increases the risk of diabetes. The persons with diabetes with obesity, they have higher chances of dyslipidemia. They have higher chances of hypertension. But commonly, this disease, diabetes, is very well known across the country. People understand the importance of the diabetes control. Now, in last almost 2 decades, all those doctors who joined and they are listening, and we know that now we changed our approach from glucocentric approach to the prevention complication prevention approach. Now we are no more only sugar controlling. We try to control the A1C along with blood pressure, cholesterol, smoking cessation, using the molecules in such a way for diabetes control that it also prevents the complication. But now your question is that how we can prevent the non-communicable disease NCD along with the diabetes, and what are the preventive ways by which we can prevent not only diabetes but also the obesity, also the hypertension, also the dyslipidemia. Now, if you see, all of these have a common soil hypothesis. If you work for prevention of diabetes, you are actually preventing the heart disease also. If you are preventing the diabetes, you are also preventing the obesity too. If you are preventing the diabetes, there are all chances that persons will have less chances of hypertension and also will have less chances of dyslipidemia, and in future he will not develop even cardiovascular disease also. So all non-communicable disease prevention, the lifestyle is a major challenge, which is a major challenge for us to have diabetes too. So if we prevent the diabetes by lifestyle modification, and that was our in defeat diabetes, that was our primary message which we had given. More than 1 million people have reached out to hundreds of thousands of places where we could do their not only sugar checking, we could ask their BMI, their waist circumference, we could educate them about what is the importance of this abdominal girth, how it can increase the risk of diabetes. We were having the risk factor, we had shown them, and how diabetes prevention alone can also prevent them from getting other non-communicable disease like hypertension, cholesterol, and mainly the heart disease. Now, in non-communicable disease, other disease also comes like the cancer and the stroke. And we know that obesity and diabetes also increases the risk of cancer. And stroke is also directly related with diabetes, but more with the hypertension also. So if we can prevent diabetes and hypertension both, probably you are also preventing the stroke. So a NCD program is there with the government of India, as Dr. Vasant Kumar very rightly said, that if organization can work along with government, along with this NCD alliance program of the government or health ministry of the government, and if we can work with the CSC, PSC, as we are reaching out to the rural area, I'm sure this increasing awareness will definitely help people to prevent the diabetes and other non-communicable disease. And at least those who develop the diabetes, by educating the doctors, we are trying to prevent the complication, because now it's just not the sugar control. We try to control the cardiovascular disease, we try to control them for other communicable, non-communicable disease to be prevented also. So the heart disease can be prevented by educating the doctors. We are now no more centric only on glucose. We try to educate the people for diet, for exercise, for smoking cessation, for blood pressure control, for cholesterol, and now medicines are also such that will also help them for prevention of these complications. So is in total, a NCD can be completely prevented, or at least if it not be prevented, then at least it can be delayed, because we are getting younger and younger persons who are getting diabetes or heart disease in like 30s or 40s. So at least if we can delay it by another 20 or 30 years, that itself is a big work which we are doing.
So, Dr. Bridge, I want to come back to you. We have seen epidemiologically that we have a higher incidence in the second and third decade as compared to, the Western populations, which have their incidence later, maybe fourth or fifth decade. And we are exposing a younger population, to risk of all kinds of diabetes and NCD complications. Isn't it time that we started effectively doing aggressively a campaign, Save the Young, and see how we can, shift this entire curve and, make our younger population more productive, more health conscious, given the fact that our younger population, and for by and large, let not blame the young population, but the slowly creeping in of unhealthy habits. So how can you increase the awareness of health in the young population?
I think that's a very important suggestion and very important point also. Prevention of diabetes and prevention of all comorbidities that come as a package with diabetes is very important because none of them is curable. They all are treatable. The person has to live with these diseases for rest of life, and quite a few of them can be quite crippling in terms of the overall lifestyle, and also compromise the quality of life. And if somebody gets complications that can impact the occupational aspect of life, the income may be compromised, and in fact the expenses can go up to such an extent that the whole family faces the brunt of the disease management expenses. So prevention is the best policy, but unfortunately this is not taken seriously, and it is high time that we start educating younger people, and maybe at school level we incorporate some prevention education in the educational curriculum to tell these children who are graduating from the school that focusing on health and prevention of disease is very important component. And once it comes from the school teachers to school children, it comes, they are very receptive to what their teachers are telling. They may not be receptive to what parents are telling at home, but what they listen to all the teachers. So if that time this concepts gets imbibed in their minds when they are young, and that focus on health for rest of life is important. If you stay healthy, you will live a better quality of life, you will be better off in your profession, in social equations, all aspects of life you are in fact better off than a non-healthy person. So prevention should start as early as possible, but it is never too late also. People who have not started early, at whatever time they start with lifestyle interventions to improve health, it in any case benefits for diabetes, for blood pressure, for obesity, for heart disease, and so on. So it is very, very important to focus on preventive aspects of disease. And it is not just the young people. Yes, we should start early. We should start at the early part of youth. But if we have not started there, we should start it whenever and wherever possible, and it is going to be helpful.
Thank you very much, Dr. Bridge. Now, in my conclusion, I want to really take the opinion of all our three stalwarts who have spared time to be here today. We want to make India the diabetes care capital and lose the tag of the diabetes, population of the highest diabetes second highest diabetes population, aim to be the highest population. So we need to sort of, change this entire tag that we carry with us and make it a more productive tag that we can show the world that we have shifted our position from being the largest population to the diabetes care capital of the world. And I want quick thoughts from all the three stalwarts that, from our body, how can we send, effective treatment messages or the guidances or advocacy or, collaborate with people nationally and internationally to see that this dream becomes true. So I'll start with Dr. Vasant Kumar and ask him his opinion that how can we take forward quick message from you for the everybody.
Sanjay, we have already discussed about, you yourself just said collaboration is more important. I also earlier said that it's the government, all the NGOs, professional organizations, responsible civil bodies, all of us have to work together. Otherwise, I can tell you it's an impossible goal that we are looking at, but we can make it possible. We need to do that, but not by simply saying about it, talking about it, but we have to put it in the practice, show it, and we have to actively work with all the governments, civil organizations, professional organizations, and we have already set it on the table. We are doing it, but we alone cannot do it. But we will work as RSSDI with more than 9,300 members, with very effective secretariat and all the office bearers we have. We are not going to rest till we continue to do this, but we need to do it together. I'm sure we would like to listen to our two colleagues.
Yes, but Dr. Bansi, you have been very active, and you have been particularly active in district coordinator networks, taluka networks, because that's where the gap in our healthcare system is big. And if we have to make effective contribution to diabetes care, then you have to bring into focus these populations. So, what's your thought on this?
Two things one we can do. One is the capacity building, and that is what we are trying to reach out to the rural doctors and teaching them, educating them, and creating, improving their standards of care also. If we can teach them, if we can educate them, probably that will improve the care for diabetic patients who is staying in the rural area, can't afford to reach out to the secondary or tertiary care. That's number one. The second is increasing awareness itself. Awareness increase, why it is required. As we know that 50% of our diabetic population, they don't know they are diabetes. Those who are having diabetes, they know about diabetes. 50% of them are not taking treatment. Those who are taking treatment, they are not, 50% of them are not optimally treated for diabetes. So if you can understand that out of 100, hardly 12% of the population is getting the optimal management of diabetes. And how it can be improved? Only by increasing the awareness. And that's what we are doing through this social media, Diabetes Bytes, regional language program doing, which we are doing, like defeat diabetes, or trying to connect with the media or through the government organization also. So these are all ways by which we are trying, and I'm sure in coming years we will able to reach out and we will make our dream true, that we will make our country a diabetes care capital of the world rather than a second highest number of patients with diabetes, along with a lot of complications of diabetes in our country.
Thank you very much. And I just also want to ask you, I mean, rather than, you have done very effective work in type 1 patients, and you have, you yourself have been so instrumental in seeing that, insulin reaches to every child. And we want to see as a motto that no child is deprived of insulin. So would you like to say just a quick few words in conclusion about your contribution to type 1?
So Sanjay, as the incidence of type 2 in our country is so high that 80 million people are having type 2 diabetes, and we have 252,000 children who are type 1 diabetes below the age of 15. So what happened? The every doctor who is treating diabetes, considering that he is treating type 2 diabetes, so the awareness for treatment for type 1 is very poor. And that what we had started for me and Dr. Vasant Kumar, the treatment of type 1, particularly who are not affording, poor patients, can't reach out to the secondary or tertiary care center, how they can get the best treatment. And for that, not only we are going to, we are providing through RSSDI some few thousand children the free insulin, free glucose meter in the street. But that's not free, is not enough, because it's an education of these children that is more important. And again, empowering the doctors who are treating type 1 children, that's what we are doing. Now you can see in last 10 years, in any RSSDI meeting or in any symposium or any this, there is a dedicated program for type 1, because that we want to educate our doctors who are treating diabetes, and they should know better type 1 diabetes management also. This also we have started doing for the rural doctors through the district coordinator program. So, if we can improve them, they are definitely going to improve the care for type 1 children. Now, providing them free insulin, free education, and doctors who are treating them, they are also equally empowered and they know how to treat. We had also created some center of excellence for type 1. There are doctors who are interested more in type 1 diabetes. We are trying to create a sort of a mentorship. They can go to mentor's place, and they can learn more about type 1 and research. These are the ideas to improve the care for type 1 in our country, as we are having highest type 1 children in the world, more than US population. We have 252,000 as per last IDF data of 2021. We are number one in type 1 children in our country.
So, Brij, that brings me up to something that you're expert at. You've done a lot of work in the area of obesity, and that's another area that, we are very concerned because we are typically called as thin fat Indians, and we're now moving more towards general obesity. And, a lot of unhealthy habits that we harbor, and that's become the nidus for developing non communicable diseases. So, if we have to be the diabetes care capital, we also need to effectively bring down a national average BMI of the country as well as central obesity. So, what's your thoughts about this? Because you're going to be effecting this in your presidential year.
So, I think again you touched upon a very important point. Bansi very clearly told about the various comorbidities that come with diabetes. Now, obesity is not just a comorbidity, actually, it is the principal driver of increasing prevalence of diabetes. Obesity is possibly mother of all diseases of adult life, and the very important ones are diabetes, heart disease, high blood pressure, joint problems, obstructive sleep apnea, and so on. And a number of cancers are increased because of obesity. Now, unfortunate part is that we just about maybe 3 decades back we started moving out of poverty towards more affluence, and as the affluence started increasing, people started thinking that gaining weight was a sign of prosperity. It never occurred to them that this is going to be a disease, actually. And now we are very clear that obesity is a major healthcare challenge. It is a disease, though it is not yet recognized as a disease, important disease area by most of the clinicians and most of the individuals also. So people are coming to a healthcare facility for treatment of respiratory infection, urine infection, diabetes, heart disease, but they never will complain their weight as a problem. They don't ask management for weight or obesity. So I think whether it is obesity, whether it is diabetes, whether it is comorbidities with diabetes, the basic thing that we have to focus is on education, education, and education. And some of this was highlighted by Dr. Bansi also. So we have to educate people that gaining weight beyond a line is not good. We we get these bad effects of obesity even at lower levels of body weight. Maintaining a normal weight and keeping a good lifestyle is good for prevention of all these diseases. We have to educate primary care physicians on identifying obesity as a disease area which needs medical management. We need to educate people, primary care and internists, that obesity needs to be noticed as a disease and to be treated. And if we do that, we can actually prevent diabetes, heart disease, and so many important diseases of life, and reduce the mortality and reduce also the incidence of cancer and cancer related issues. So I think at ground level everything boils down to education as major component, whether it is the public, whether it is the individuals, whether it is the primary care physicians or healthcare providers.
Thank you very much. I think we're coming to the end of the show, and I'm good. Before I hand it over back to Dr. Purvi, I just want to sum up and say that we are making great strides of progress in our country when it comes to our economy, education, and obviously there is a lot being done in the healthcare area. What is important is that we should be grabbing all this and taking the advantage of the virtual world, the social media, and see how we can not only benefit ourselves but benefit the society at large. And we promise you that from RSSDI, our endeavor has always been that we put out the best of education, help our people to see that how they can get the correct information, how they can manage their health more effectively, what are the resources that we can help them with, so that no patient is denied treatment which is most important, no matter which part of the country he's in. And I think our three stalwarts have really touched a lot of information, which has been we look forward going ahead in RSSDI. I'm proud to say that we are celebrating our 50 years of existence this year. And one of the challenges that we have taken up and the motto for the future is that we want to see that we bring the best diabetes care, and nobody is denied a good health and good diabetes management for the future. And we want to see that more and more people join up with us on platforms which come from RSSDI, like this Diabetes Bytes. And we can assure you that Dr. Purvi is going to leave no stone unturned till she's made sure that all this information is available to you. So hand you back, Dr. Purvi, and congratulations to you on the 100th show.
Thank you so much. I must say, congratulations to the quintessential quartet of RSSDI, under whose leadership this initiative was undertaken, and with continued guidance from the current and future leadership, we will continue to bring better and better programs for the audience. So, I think our aim is to build and establish RSSDI portals, website, as a reliable, supportive database or resource for information for patients living with diabetes in our country, and increase the outreach of the same to all, even at the rural levels, leveraging on the technological advances available today. So, as for the future, definitely there will be several programs in regional languages as we have planned. We have also started our patient experiences program, which will help motivate and provide valuable insights that physicians often miss. There will be short, effective campaigns. There will be advisories also shared. There are videos from time to time that we circulate that will help dispel myths and establish some facts, etc., etc. So, all the valuable insights that have been shared today, whether it was patient education or data streamlining, or even preventive and managerial approaches for diabetes, they have been very well taken, and it will help our entire team in designing better programs for the future. So, with that, I extend my very warm thank you, gratitude, as well as humble congratulations to all of you for supporting us and encouraging us, and for starting this entire series. Unfortunately, we could not have our Honourable Minister today, but I'm sure we will get his feedback as well on the same. Thank you so much, stalwarts.
Thank
Thank you.
you. Thank you.
Thank you.
Thank
Thanks.
you.
Thank you.
We are off the show now.